Hi, everybody. I'm Dr. Lauren Wang, and I work with UC Health Primary Care. And I was so excited to get the invitation to come present about telehealth. It is new to me. I know it is new to a lot of you, and hopefully, this can help alleviate some of the fears you may have about trying it out because it's a great option right now with coronavirus. It's really a great way to try to keep all of our patients safe. So, hopefully, this will help put some of your fears to rest. So, a little bit about me. I'm a family medicine doctor at UC Health. I have 3 kids, and I see patients at my office that are from birth to old age. And my special interest is caring for individuals with Down syndrome. That is what I love to do the most. I also help run the transition care clinic at UC Health. And that clinic sees patients that are transitioning their care from a pediatric environment at Cincinnati Children's, and they might have more complex medical needs and they need an adult primary care doctor. So we see them in our transition care clinic and then either transition them to a provider in the community that's a good fit, or we continue to care for them long term. It's really fun. It's a really neat place. And then I also am part of the Down Syndrome Medical Interest Group and actually presenting in June at their national conference, which will be virtual. Now everything's virtual, about the collaborative care model that we have at our clinic at UC Primary Care, where some people that might have challenging mental health, psychiatric needs will see me and also a collaborating psychiatrist. So we have that option at our office as well. I absolutely love the DSAGC. I served on the board of directors for 3 years, and now I'm a member of the Health Advisory Committee. And I just love the work you do. I'm always at the Buddy Walk, and it just brings me a lot of joy to be connected to your organization. You guys are awesome. So before I start, I wanted to also thank Mark Dice at the Pediatric Associates of Northern Kentucky. He shared a lot of resources with me about how his office is doing telemedicine, and it was very helpful as I prepared this talk. So let's get started. What is telehealth, or other people call it telemedicine? It's a lot like this, where you have although it's more interactive because you're just watching me, but it's where you almost FaceTime your provider. So you're having a dialogue, but it's through either a tablet or an iPhone, or your computer. So you're not physically at the office, but you can still see your provider and in real time. So there's some pros and cons to this that we're adjusting to along with you as you adjust to it. And I'm going to review some of those, the kind of the benefits and the drawbacks, and then we'll get into walking you through what does a visit look like. So the obvious benefit right now of telehealth, which is huge, is that really this decreases your exposure to the coronavirus. Our priority in healthcare is to keep you safe. That's what I want to do as your doctor. I want to keep you safe. So the worst case scenario would be for me to make you sick by you actually coming to see me in the office. So anything that we can do virtually is going to be the priority right now, especially while we have these social distancing measures in place. So that's a huge benefit. But when you think about other benefits, there's actually some more. One, you don't have to leave your house. So some patients, it causes them a lot of anxiety to leave the house, get really nervous about a visit. We can maybe decrease that anxiety by doing a telehealth visit. Or another big thing is transportation issues. If you need to have money to ride the bus, or just the convenience factor of trying to find a ride or someone to come with you to the appointment, it removes a lot of those barriers. So definitely improves access. Now, there are some drawbacks. One, you do have to have a computer, access to a computer, a tablet, a phone, something like that, so that you can actually do the visit face to face. And sometimes then you're going to also have technology issues, a poor connection, it's a choppy visit. I've had those before where it looks like we're in the Matrix or something as we're trying to talk. That can be frustrating. But the biggest one for me is the limited exam. It is hard to obviously, I can't examine somebody over the phone. So sometimes I'll have, if you have somebody in your family that can help facilitate an exam, we get creative on how we can examine you virtually like this. Sometimes you really do need to come into the office, and we decide that as we're having our telemedicine visit, if that's necessary. It's also hard to see some things, certain rashes, it might be hard to see. You can use a phone instead of a computer. That smaller screen sometimes helps us see the back of a throat or rashes up close. So we do have some workarounds, but again, sometimes rashes, you want to be able to feel it. You really need to be able to see it sometimes. And then I think those are a lot of the drawbacks that I'm finding so far. And then, like I said, sometimes we might just say, we really need to see you in the office. Let's schedule a time for you to come in. So let's go through now what a visit would look like. So something might be happening now. Offices like ours might be reaching out to you saying, we want to schedule you for a visit. We saw that you were on the schedule to see Dr. Wang, but unfortunately she is not going to try to see you in person. She's going to try to see you in telemedicine because of the coronavirus. Would you like to schedule a telemedicine visit? And I just encourage you, be open to that and let's try it out. You might like it more than you think that you would. And then, so that's an option. But another option, if you're calling to make an appointment, you can ask for a telemedicine visit. Ask if that's an option, because like I said, it's a good way for you to stay out of the office and out of the germy waiting room. Even though we're taking a lot of precautions, many precautions, we're doing it as safe as we can if we need to do a visit. But if you can avoid it, that's great. So say you get scheduled for the visit. One key thing is you want to log on to that visit 5 to 10 minutes before your actual appointment time. It's just like think of this visit as a real in-person visit. You wouldn't show up to the doctor's office right at the time of your appointment and walk in. Hopefully not. Sometimes if you're me, you would do that, but hopefully not. You try to come 5 to 10 minutes early and you're going to wait in the waiting room. It's going to be the same here. What sometimes happens though, the reason you want to log on early is because if your computer's having issues or something like that, you have time to fix that. But, sometimes appointments run long. So even though we're doing a lot of these virtual visits, sometimes I'll have a more complicated case and it might take me a couple extra minutes and I am running late. So you might be on 10 minutes early and then I'm 10 minutes late and you've just been sitting there for 20 minutes. Kind of picture that like the waiting room. The good thing is you have things in your house, hopefully, that can occupy you while you wait a little bit better than you can be occupied in our waiting room. Also try to be in a quiet room. This is quiet right now. My kids might walk in at any moment, but you want to try to minimize your distractions. Now, some of you, I know when you come see me, you like to have some type of distraction, whether it's your iPad, which you might be using for the televisit, or something, a toy or something. You all know what makes you comfortable when you're seeing the doctor. You could have that with you during the visit, but try not to have like the TV blaring really loud because then we can't hear each other. We won't have a productive visit. Or you don't want to be texting or eating or drinking, mostly because I'll get jealous if I see your food and I like it. So that sort of thing. Also, if you're the patient, you need to be there. Don't just send your parent or someone who knows you really well to do the visit. The patient should be at the visit too, if at all possible, even if just for a little bit, so we can check in with each other too, okay? The last thing that I think you should try to have at the visit is, if you can, vital signs. So those of you who have a blood pressure monitor at home, and maybe you want to get some of these things if you think you're gonna want to do more telehealth visits in the future, but a blood pressure cuff, and your doctor can order that for you if you don't already have that. A scale, a thermometer, a pulse oximeter, the little thing you stick on your finger and it tells you your oxygen level. Those are all really helpful to have at home because I can say, okay, just checking in, what was your blood pressure? What was your pulse? What was your oxygen level? And that gives me a little bit more of a physical exam when I can't get one otherwise. So that's all helpful information. If you have that, also if you have diabetes, you want to check a blood sugar, have that information. All of those pieces are really helpful if you bring them to your visit so that when we're sitting down, you have it right in front of you and you can give me the information. We can have a productive session together. A few little tips when we're on the visit. If your quality is poor, like if it's really choppy and like I said, it feels kind of like you're in the Matrix, you can make sure you're on a newer computer or a newer phone, if at all possible, with a good internet connection. And you could also lower the resolution if you need to. If you're hearing an echo, what could be helpful is to try putting on headphones, and that can sometimes cancel out the echo that you're hearing. So you're going to have your visit. Did you just see one of my kids behind me? That's my oldest. Wait 1 second, buddy. Wait 1 second, buddy. I'm almost finished. Okay. Thanks. See, distractions happen. It's okay if that happens during your visit. We understand that too. So you're going to have your visit, and then your medication's going to be sent electronically if you needed medication. You may still need to go to the lab or the x-ray or some imaging center. If you do need to do that during this time, I just really encourage you to wear a mask to protect yourself and to protect everybody else. But we still may need that information. And like I said, the last thing you need to keep in mind, you may still need to come for an actual visit. That might still be a possibility. So be open to that if we just decide at the end of the visit, I think I should see you. I need to do more of an exam. You'll be billed through your insurance like you always are. A lot of these telemedicine visits are being covered by insurance, which again is a great option moving forward if this is something that you end up liking. So I hope this alleviates some of your fear about telemedicine. I know I'm getting more used to it and will continue to get more used to it. Just try it out. I really miss seeing all my patients in person. If you're one of my patients, know that I really miss you. There's nothing like seeing you in the office and just getting your energy and seeing you face to face. There's nothing like that. But this is a decent substitute for the time being. Our priority is to keep you safe. So remember that. That's why we're doing these visits. It's to try to keep you safe. And I just want to also offer up, if you have any more questions about telehealth or your health or the health of your loved ones, please always feel free to reach out to me. And hopefully the DSAGC can post my information, and I'm always available to help. I guess my kids are all behind me, so, well, 2 of the 3. Do you guys want to say goodbye?
Bye.
Stay safe.
Bye.
Stay safe, everybody.